My name is Melissa Gargiulo. I am a hospice nurse and I love what I do. And when I say that, people always go, "What? How can you love hospice? You're around dying people all the time." But I'm not. That's not what hospice is. Hospice is about living. Hospice is about making every moment that you have as comfortable and full of joy and pain free and lots of good bowel movements. And I know that's a weird thing to hear in a video. We never talk about our bowel movements, but we do in hospice and in healthcare. It means keeping the body as comfortable as you can up until the very moment when your body fails. That's what hospice is about. And unfortunately, hospice has a really bad reputation because of what you see on television. It's not like what you see on television. We're not all standing around going, "Kumbaya," and singing, and then there's this dramatic pose. It's not that at all. Hospice is normal. It's in your home. It's in a long-term care facility, wherever you're living. We come to you. And we don't boss you around. We don't change you things. We don't judge you. I had a lady one time, I went to admit her husband onto hospice and I came to her home. And the first thing she said was, "I am so sorry, my home is a mess." And I immediately sat back and went, "Oh my goodness, she thinks I'm going to judge her." I don't judge you. None of us are going to judge you. Actually, if I went into someone's home and they were on hospice and they had a caregiver who was doing it all by herself, if her house was immaculate, I'd be worried because it meant she wasn't sleeping. Hospice is not about judging people. The reason I'm telling you this is if you're watching this video, then probably someone has mentioned to you that you might need hospice. And immediately you said, "Oh no, I don't want hospice, not for my husband, not for me," because of this bad reputation that we have. Hospice is not about dying. Hospice is about living the very best that you can for as long as you can. And the thing about hospice people don't realize, it's free. It's free. Medicare knows that as your body declines, you're going to need more things. You might need more medication. You might need Depends to keep your skin healthy and clean. You might need special equipment like a hospital bed so you can get in and out of bed easier, or a wheelchair. They know all this is going to happen. So when you've been paying your taxes your entire life, it's for this benefit. You've already paid for hospice. Everything that we provide to you is going to be free. How amazing is that? Not only are you in this situation where your body is beginning to fail, or someone you love, they're taking care of you, or you're the caregiver and you're taking care of someone, maybe your husband of 45 years, and you're watching this decline. You're exhausted, emotionally and physically tired and stressed. Finances is probably going to be an issue. Everything that hospice provides is free. We even pay for a lot of your medications that you're already taking. Medications that help with pain and anxiety, constipation medications. All of those things keep you comfortable, and that's what we are about. This video is going to be more geared towards people who have renal disease. Now, renal is a medical term. I'm going to throw it out the window right there. It's your kidneys. And the reason I do that is from personal experience. I'm a nurse, and doctors still talk over my head. They use medical terms that I don't understand, and I just want to say, speak English. I'm going to be speaking English with you. I'm not going to use medical terms. Let's just talk about the human part. When your kidneys start to fail, these are symptoms that you're going to see. And when you see these happening in yourself or in someone that you're caring for, or maybe even in your neighbor, when you see these things, then you might start thinking, I might need to talk to someone about hospice. If your kidneys are bad enough that you're on dialysis, and you have decided that the dialysis is so hard on you that you don't want to do it anymore, and we know how hard dialysis is on your body. If you're to the point where you're thinking, I don't want to do dialysis, I just want my body to be comfortable and to do what it's naturally designed to do, then you are ready for hospice. There will be no question you will qualify for hospice. The reason I use the word qualify is because Medicare and Medicaid is going to pay for hospice for you. So they're going to want to know certain things. If you stop dialysis, then you qualify for hospice. If other things can be happening on your body too, and we call them comorbidities, which basically means there are other organs in your body that are beginning to fail. Sometimes you have to look at the big picture on someone. Their body is declining just overall. So some of the other organs that might be affected are your liver, your kidneys, your heart, your breathing, things because, as you know, the kidneys, they're the big filter in your body. They're the ones that take all the grunge out of your blood and then you pee it out. And then that circulates the good blood. But if your kidneys aren't working right, then it doesn't filter as well. So other parts of your body are going to get sick too. I'm going to mention two numbers. You don't have to know these numbers. The reason I'm giving them to you is if you're like me and you're a list maker and you're watching this, you're going to write down these numbers. You're supposed to have an albumin, it's ALBUMIN level of less than 3.5. And the other number is your creatinine, and that is spelled CREATINE. And that level is supposed to be less than 10 per minute. Okay, that's the only numbers in the whole thing. If you're like me, you have written those down, or you can watch the video again and write them down. Take them to your doctor. The next time you go to your doctor and you tell them, I watched this video, she was saying these symptoms, I think those are ones I have. Can you look at these numbers and tell me? He'll be able to tell you. And the good thing about that is some doctors don't want to talk to you about hospice. It's hard for them. Even making this video right now is hard for me. My heart is beating. And it's because hospice is such a fragile thing and there's so many negative emotions that go with it because people don't understand. You take that in, you will start that conversation with your doctor. Other things to look for is, are you getting weaker? Is the person that you're caring for getting weaker? Are they falling? The reason being, as your kidneys fail, it's changing the chemicals in your body, and it actually affects your brain, and you can lose your sense of balance. That's why you're starting to fall. You'll also notice that you might be getting more infections. And again, that's because your kidneys are not filtering all that grunge out of your blood. You might be getting urinary tract infections, which is pretty likely. And you might be getting things like pneumonia. If you're the caregiver for this person and they're getting infections, do not blame yourself. It is nothing that you are doing wrong. And I mean that so sincerely. Don't blame yourself if the person you love and caring for falls or gets an infection. It's not you, it's the disease. We as people, we have the right to fall at any time. Yesterday morning, coming to the office, I fell. I bounced, I got right back up, I smiled. I hope no one saw me, but I fell. Why wouldn't the person you're caring for have that right? Don't blame yourself. Caregiving is hard. If you're the patient and you're worried about your wife or your daughter or the staff, whoever's caring for you, know that hospice helps them too. We literally surround everyone around you and give them support. And if you're worried about your wife who's caring for you after you pass away, hospice will stay in contact with her for 13 months after you pass. And the reason being, everybody grieves differently. And sometimes 3 or 4 months later, everyone else has gone back to their life. The person who loved you, who was caring for you, they're still grieving and nobody understands. And that's where hospice is, because we understand. I personally understand what it's like to worry about someone I love who's going on hospice. Another big thing is weight loss. As your kidneys fail, your body is not able to digest food as well as it is, and you may lose weight. On the other hand, you may gain weight, but it's not because of nutrition. It's because your kidneys have a disease and they're not able to filter all the fluid out, and you might notice that you're building up fluid under your arms, your hands, your feet, your ankles, right underneath here. This is nothing that you're doing wrong. This is just a symptom that your kidneys are ill and they're not functioning as well as they are. If you're seeing this stuff, if you need more help, if you want the caregiver to have more help, if you love this person and you're saying to yourself, I can't do this, I need help, talk to hospice, call Intrepid, We're not going to push. We don't push hospice. It's too important. Call and just ask questions. And if you're not ready for hospice and you're a list maker like me and a contingency plan maker like me, just call and get information. Wouldn't it be better to know? And then later on, when things decline, you're like, okay, I'm ready to stop dialysis. I already know about hospice. I'm going to call Intrepid. I'm urging you because I have been in the position with someone I love, 3, where I didn't have information on the first 2, but on the third one I did. I knew when my mama was ready and I knew how much it would help. And my mama actually got better and came off hospice, which is not something people know about that. If you're on hospice and you get better, you don't need us, we go away. Or if you're on hospice and you decide you don't want it, just say so and it stops. There is no pressure with hospice. It is a win-win-win situation. Because the reality is, if you're on hospice or you're not on hospice, your body is going to continue to decline. Why not get help? It's free. Why not let us help you? I have thrown a lot of information at you. You don't know me. I'm a stranger. All I can say is that I am talking to you from my heart. I wish you the best of luck in whatever you decide. And thank you for listening.